Hi everyone, welcome back to Boston Children's Answers Parentcast. I'm Dr. Jennifer Arnold, your host. Today we're talking about how sports injuries can impact the well-being of our kids. As always, let's start off with a question from our guest parent.
Hi, this is Liam. My son tore his ACL and hasn't been himself since. He seems down and doesn't want to go to practice or even watch his team. Is that normal?
Thanks, Liam. Injuries can have a big impact on young athletes, not just physically, but also mentally. So here today, we're going to explore how families can better support young athletes by chatting with our expert, Dr. Melissa Christino. Dr. Christino is an orthopedic surgeon here at Boston Children's Hospital Division of Sports Medicine. So thanks for coming today.
Thanks so much for having me. I'm excited about this.
I always love to hear from our experts how you got into the field that you're in. Could you share with us?
Sure. So I do orthopedics, as you mentioned, and I primarily specialize in sports medicine. And I was a big athlete growing up. And my experience as an athlete, I think, also helps me relate to what a young athlete might be feeling when they're going through injuries. And so I guess my own involvement inspired what I do, and I'm grateful to still be in this world.
Thank you for sharing. How common are sports injuries in young athletes today?
I mean, as a sports medicine surgeon, they're very common for me because I spend all day long seeing injuries of different types. But, you know, across the country, kids are playing in more and more sports. They're playing all year round. They're on club teams. There's higher levels of specialization. There was one study a couple years ago that put youth participation in sports. Over 8 million people or kids are participating in athletics. And so you would imagine that with 8 million people, there is a significant number that then sustain injuries, whether that's an acute injury or an overuse injury, more wear and tear that's just sort of nagging somebody.
That's not a small number.
No.
So you obviously deal with the physical impact, but you also help care for and support kids from an emotional perspective. So how can these sports injuries affect young athletes emotionally?
I think traditionally, that might have been something that as a orthopedic surgeon, maybe we didn't think about. But when you see kids in the office get injured and maybe have to be out of their sport for a prolonged period of time, it's very devastating. And if you told me as a 14-year-old that I'd have to miss 2 weeks of practice, it would have crushed my life.
Yeah.
You know, a short amount of time is a long amount of time to a kid or an adolescent.
What are some of the sort of the feelings and the emotional reactions that you see in kids?
One of the most important things to realize is that these emotional reactions are totally normal. A lot of feelings that we see are sadness, frustration. Kids can have some more significant emotional reactions that border on like depression or anxiety. And so it is really important to watch out for patients that are maybe experiencing these things and get them the help that they need, because that's ultimately going to help them recover from their injury.
Yeah, and I imagine that too, you know, for these kids and teens, these young athletes where sports is such an important part of their life, that being out of the game affects their identity as well. Can you talk a little bit more about that?
Yes, and that's actually one of my key interests in research is this concept of athletic identity. And, you know, every person, every child, every grown-up has their own relationship with sports. People that have sports as their main thing or only thing, you can imagine if that's taken away, that can be pretty devastating. Whereas if you know, maybe you're an athlete, but you also play the piano or something like that. If you get injured, you've got some other interests to sort of fall back on. And so I think it's important to understand every athlete's relationship with sports, what their goals are in order to be able to treat them.
Even as adults, our identity is tied into so much of the things that we're passionate about or that we do or that we're trying to excel in. And so I can imagine this has a big impact on a young athlete's mental health too. When it comes to the identity piece, knowing that all of this could be happening in the background, how does that actually impact their recovery?
Having a strong athletic identity actually can be really helpful in recovery because it's really motivating for kids to get back to their level of activity and their sport. And so it can actually help drive rehabilitation.
That's great.
I think one important thing for families to know too is that you don't necessarily have to be the best athlete on the team to have a high athletic identity. Okay, you could just be really happy to be there, but that is your goal, was to make that, freshman team or something like that. And so you might identify really high with the athlete role, just as maybe the best player on the team likes sports, but it's not their only thing. So it's really an individual thing. It's tricky to navigate.
Wow.
And that's why asking some questions when we're seeing patients in the office to really understand who they are and involve them in the process helps us take better care of them.
It's actually really interesting that you say that it might not be even the top athletes that have that strong identity. And it kind of reminds me of my son, who actually is a little person but has a strong athletic identity, particularly to basketball, and is always out there practicing. It's a big part of who he is.
Yes, yep.
Oh,
we all have our hopes and dreams,
Yep.
and it's important to realize those things. That being said, I think there's a lot of literature showing that, kids that may play more sports and more hours of sports probably have a higher level of athletic identity, but it's which comes first and
Chicken or the
drives
egg.
the other, right?
Yeah.
So it's kind of hard to determine that, but we like to think that any athlete coming to see us has some sort of relationship with their sport, and it's important to take into account.
Yeah, and to support that.
Yes.
What are some of the things that you might see or need to be on the lookout for as a parent or as a clinician for an athlete with an injury?
That's a good question. Some of the things we hear parents say is that the kids seem sadder, they seem more withdrawn, they might stay in their room a little bit more and engage less with either their family or their friends. It's also normal to be pretty irritable, and so we see that a lot too between kids and their parents.
So not just the teen, not just a factor of being a teen potentially.
Correct. There's a reason behind that.
Yep.
Frustrations, and then it can be a precipitating event for more of a serious mental health condition like depression, anxiety, eating disorders. And so sometimes an injury can be a catalyst for these things. And so we really want to keep an eye out and try to identify kids that might be going down a path like that so that we can intervene and help them.
Which makes it all the more important to be really looking at all of these things, not just the physical impact of that injury.
Correct. Yes.
So knowing how, there can be this psychological impact for an injury for a young athlete, are there certain types of injuries or situations that might be more at risk?
There definitely can be. I think some of the things we worry about more are the injuries that are taking kids out of sports for longer. Classic example is an ACL tear that requires surgery. Those kids are out of sports for 8, 9+ months. And we also see a good amount of overuse injuries as well. And those can be hard to treat because, we want to allow the kids to play, but they're still having their symptoms. And so we let them play, but, it goes up and down in terms of symptoms and can be a little bit of an emotional roller coaster also. So any injury that's associated with a long recovery, we see with some more maladaptive tendencies in behavior.
And if a parent does notice that their athlete and their family is struggling, what can they do?
One of the most important things that I encourage parents to do is really try to normalize that experience for their kid. I think a lot of kids internalize this. They don't feel like they should have these feelings, and it's really important to acknowledge that you have these feelings and they're important. And so just reaching out to your kid, seeing how they're doing, telling them it's okay to be sad about this. Many of these injuries also occur at key times in life. So, a lot of injuries in high school, maybe it's recruiting season, maybe the championship game is coming up. So a lot of these things happen at very high stakes times, and those can be particularly hard for both athletes and parents to deal with.
Is there anything else that parents can do, particularly maybe, with the team or the coaches to help support?
Yes, usually the team and the coaches are central to the athlete's life. And so keeping them engaged with their team, maybe they keep score, maybe they're the team manager during a time where they have to be out, but that can really keep them engaged, and you hold on to that athletic identity piece a little bit, right, which can be helpful. So we don't want the athlete to completely withdraw from feeling like they're an athlete, because that could lead to some problems.
Yeah.
So keeping them engaged with their team is really helpful. Coaches can be a huge support system for somebody that's injured, as is the physical therapist, the family, their friends. Creating a network of support, I think, is really helpful for an athlete going through something.
When I love that piece about staying connected, right, with your sport, with your team, with your coach. I mean, even if it's in a manager role, I could see how that could have so much value for helping to keep their, I don't know, maybe just from a mental perspective, right, to stay focused on, their recovery piece.
Yes, yes. And we always want to make sure that that doesn't come at the expense of their physical therapy, right, and their own attention to their body and their recovery. But there are ways to balance that nicely so that people still feel like they're connected, but also are devoting the time to get better.
Yeah. And that piece that you mentioned too about staying connected as parents, so much of what we can do as parents is just to stay connected. So can you talk a little bit more about that?
An important part of staying connected is really understanding what the kid is going through. And so I think it's really important when you're in my office seeing me for an injury, allowing the athlete to speak and express their own opinions kind of helps them feel like they're part of the process, right? And so parents can kind of support their child by giving them some autonomy to describe how they're feeling. Again, just checking in from time to time if they notice that the behavior is a little bit off, like, hey, I noticed that, you seemed a little sad. Is there something going on?
Yeah.
And I will say that people are often surprised at the answers that they get when they just ask the question.
Wow.
I know as medical providers, I feel that. And sometimes maybe the kid doesn't want to talk to the parent necessarily. Maybe they'd rather talk to a friend, and having the friend reach out is helpful. Or maybe, honestly, they would tell me because I'm somebody that they don't know as well. And so that's why it's important for me to sort of ask those things when they come into the office too.
So it really takes a team approach to really figure out how that athlete is managing and really what their needs might be. Yeah, sometimes just asking. Yes. It's hard as a parent, but it really does. Yes. It does help.
Yeah.
What are some of the things, the pressures or the fears or the things that you hear from a young athlete who's out, because of an injury, thinking about when and how they can get back into, playing again?
That's a good question. Anxiety or around returning to sport can be really significant. It can be anxiety about whether they go back and maybe they're not at the level that they were before. There's also a lot of fear, especially with some of our surgical procedures, about they don't want to get injured again. So fear of re-injury is a big thing.
Okay.
There's actually some really interesting literature on psychological readiness to go back to sports with ACL reconstruction specifically. And that actually has been the most predictive factor at determining whether a child goes back to sports or not.
Psychological readiness. Is that something that, you and your team would help identify in athletes?
Yes, we've done a number of studies looking at psychological readiness. The brain has to match the body, right? Yeah. And so if we're anxious about going back to sports, we'd like to get them to a place where they're confident in their knee or their shoulder or whatever they had surgery on to be able to perform at the level they want to perform at. We want their confidence to be there. We don't want there to be a discrepancy there, either overconfident or underconfident.
We've talked a lot about those athletes that have an injury and all of the emotional impact of that. What about athletes who may not have an injury? How do we look out for their psychological well-being?
So sports are incredible at, I think, developing coping skills. I feel like I learned so much about how to interact with others by playing sports, so there's tremendous benefits. But there can also be a lot of pressure around that, pressure to perform at your best level, pressure to keep up with your friends, play on the club team because everybody else is, and you feel like you're going to fall behind if you don't. Depending on the person, there can be a lot of internalization of pressure too. I have to do well. My parents aren't going to be proud of me if I don't.
That makes me also curious about big moments like the championship games or things like that. Are those times that, parents should be particularly, vigilant, checking in on to see how their well-being is? And then also, does that put them at an increased risk of injury?
I think that also championship games and such are also very exciting and motivating, right? So it is a good idea for parents to check in general, right? And see how their kid is feeling about the upcoming game. We see a lot of kids that maybe are looking at college scholarships or thinking of going professional, and that can be associated with anxiety, because if you're on that path and something maybe takes you off that path, whether it's temporary or more permanent, then that can be hard to deal with too. So there's pressure related to that. If you, are a young athlete and you want to be a professional baseball player, there's a lot that has to happen in the interim, and there can be pressure associated with having that lofty goal. So making sure that your athletes still doing the sport because they love it is really important.
Yeah, because you really want them to be able to balance that pressure, that it's something that drives them in a positive way, fuels them, as opposed to, is really causing anxiety or depression or other complications.
Right, or you don't want your child to burn out by doing too much too quickly or,
And pushing too much, yeah.
Right.
That's really helpful to hear because I was not an athlete growing up, so this is all new to me, but I'm learning so much, and I'm sure it's going to help our parents because so many of our parents have kids that are young athletes, and they're driven today more than ever before, I think.
Yes.
Yeah.
Yep.
So that brings me to how, you and your team, helps to take care of kids from a well-being, a psychological perspective when you're treating young athletes.
We actually have a very unique program at Boston Children's. We actually have a behavioral health program, which is embedded in our sports medicine division. And so,
amazing.
Yes, it is really great. We've got a number of psychologists. We have a couple mental skills coaches, and they work really closely with us as surgeons, as well as our non-operative physicians, physical therapists, and so forth. And so we have resources sort of at the ready, which is nice to be able to offer families and patients, whether they're going for surgery or whether they just, have noticed some performance issues and want to kind of work on those things.
So you can treat and you take care of a range of athletes at different times, right?
Correct.
So it doesn't just have to be an injury that brings an athlete to you for support.
Yes, it can be, other things going on in their life. We get referrals for mental skills coaching from the community as well. And so that can be really helpful.
That's really neat. It makes me so happy to hear that, like, so many of our programs at Boston Children's, we're focusing on more than just the physical ailment and thinking about the psychological impact as well, which is huge.
Right.
Yeah.
And I think our program is really unique throughout the country. We're lucky to have it. Sometimes resources are not that plentiful in other locations, but it really does make a difference. And whether it's a parent or a healthcare provider that identifies an athlete struggling, we can get them plugged in quickly to resources that can help them.
That's great. I imagine that you have a pretty big multidisciplinary team that helps to support athletes, physical and mental well-being. I was wondering if you could share what some of those different experts are in the team.
Sure. So our psychologists are, they work really closely with kids. They might see an athlete for depression, anxiety, or just sort of adjustment to injury. And they do a lot of counseling. They do some cognitive behavioral therapy, which can be really helpful. Our mental skills specialists are slightly different. So I sort of equate them to when we have a physical therapist to help us do our exercises for your knee, instead of doing your exercises for your knee, the mental skills coach is helping you do exercises for your brain, right? So
they're like a coach.
It's like a coach, yes.
That's
and
great.
So we're not delving into sort of the anxiety, depression, eating disorder realm,
Yep.
but we're staying more on goal setting and visualization and modifying self-talk that can be really helpful to either improve performance or, get you through certain parts of the injury, because it can be overwhelming to think about all of the things, right, when you're initially injured. And we've got to take it one step at a time, and we can't predict what's going to happen. And so, it's hard to stay on that track, especially for a young person that just wants to be back on the field again.
That makes sense.
We're really proud of our sports behavioral health clinic. It really is sort of one of the leaders throughout the country in this multidisciplinary care, and it's just a tremendous resource to have. We're doing research. We're trying to understand more about what kids are going through when they recover from injury, and so we hope to grow the program and be able to take care of our kids a little bit better. I think for communities that don't have the resources that we have, great people to help with some of this are their actual sport coaches or their physical therapist or athletic trainer. These people can really be helpful to kind of boost it. If an athlete needs a little boost or a little lift, you can be like, you're doing a great job, keep going. Even those little things can make a big difference.
Maybe even reaching out to a mental health expert might be supportive as well.
Yes, and pediatricians are a great way to kind of gain access into that, depending on the community you're in.
So I want to take a minute, if that's okay, just to kind of break it down. You have those that are, injured that you care for. those that are returning to sport that you're caring for, and then those that are, maybe not injured, but might be trying to manage a lot of pressure. How do you approach each of those different athletes?
I think for each athlete, really understanding what the issue is at that time. For the athletes that are injured, it's probably mostly about adjusting to the injury, what that means for their time out of sport, their social ability with their friends and so forth. And, a lot of people are worried about pain after surgery. What's that going to look like? Am I going to be able to walk around? So there's a lot of anxiety around that. If we're seeing an athlete sort of repetitively for the same injury, kind of asking some questions about, are we doing the right things to try to get you better? Around returning to sports, there's a lot of excitement, but also some nervousness that they don't want to get injured again. And so we can help athletes with that specific aspect. And then for our athletes who are, playing their sports, maybe we see them occasionally for like a little injury that gets better.
I imagine for those kids that are injured and returning back to sport, you might find that some young athletes don't want to go back and some athletes, just can't wait. What is your approach to supporting those kids?
If a child wants to go back to their sport, that is absolutely our goal. But it's also okay to make the decision that, maybe you don't want to continue with that sport. Maybe you want to switch sports. Maybe you want to do another activity. And so, we try to identify what the goals are for each athlete. And we have seen, a number of, especially young women with multiple ACL tears and maybe say, I might take a break from soccer and try something else. That's okay, right? We want you to be happy and confident in what you're doing. Making the best choice for the athlete and their family is ultimately what we want.
And I imagine having that, multidisciplinary team that you have probably really helps to uncover what is that true goal. Because I'm just imagining that maybe some athletes say one thing, but maybe don't really want to go in that direction.
Yeah, and especially during adolescence, it's a very confusing time. You're trying to figure it out. And sometimes it is helpful to just sort of talk those things out. If you want to be back on the field, back on the court, that is my goal with you, right? But if you decide that you want to go a different path, that is also fine with me, and we try to work to get you to that place also.
That's great. And also, I'd love to dive in a little bit more for young athletes that are just dealing with pressure. What are some of the techniques that you help to support those kids?
Just with a disclaimer that I'm not the mental skills coach, but I have learned a lot from our mental skills coaches. They do a lot of goal setting, resetting, visualization, breath work, breathing exercises, and so forth. And so finding ways to kind of calm the nervous system can be really helpful at calming that anxiety and then allowing the athlete to perform at the level that they want to.
I think Simone Biles brought around how important it is to have psychological health support for athletes. And I admired that when she came out and was so open about that. And it sounds like really those skills that you're teaching to these athletes is critical for both their physical and their mental well-being.
Yes. And, that was really sort of a groundbreaking moment, I think, in sports to see this very top level athlete who made a decision in a very high stakes environment for her own well-being. And I think giving other people the permission to be able to do that when they need to is really important and really is a good role modeling example.
Yeah, it's great. It speaks to why this is so important. So I imagine in your work, you often see parents that are really invested in their kids' sports, trajectory, wanting them to have so much success. Maybe there's pressure involved there. Maybe even it's just living vicariously through their young athletes' sports career, so to speak. How do you advise and support parents so that they can better alleviate and support their athlete as opposed to contributing to the pressure?
Yeah, that's a tricky question because the parents are so involved in their kids' lives, right? They love their athlete. When they get injured, it has an effect on the parents too. There are really bad times to get injured, like before the championship and when college scholarships are on the line. Some of the things the parents can do is just understanding there's no good time to get injured. And so having that perspective that there's more than just, the sport, and that their child's health is the utmost important is really helpful. There is some literature in pain in orthopedic patients that when parents worry a little bit more, the kid tends to worry a little bit more. And so that's an important thing to kind of take away. We want to acknowledge that both the athlete and the parents might have a response to this, but the parents can really help shape the response that their child may or may not have.
Just being self-aware and moderating your own response. I mean, I think that makes so much sense because parents are probably dealing with like a similar stress when an injury
That's
happens
right. Yes.
as the kid, because they're like, oh no, like this is not good timing for my young athlete. And you start to feel that emotional stress and anxiety just like the athlete does. And we have to try to model maybe how to manage that better so that it doesn't negatively impact.
Yes, and that's
kid.
difficult,
Yeah.
but I think exactly right. But I think the more that we can do that, and just sort of be like, okay, this is what we've got to deal with. You can have those emotions, but important to just sort of take a step back and realize that the place we're all trying to get to together.
Yeah. Which again brings that whole well-being piece to be so critical for the whole family. So I understand that you're also the director of sports and mental skills research, and we always love to learn more about what is going on in the research side of things. So can you share with us a little bit more about that?
Yes, I think that has been really growing in the sports medicine world over the last couple of years, and we're working really hard in the Sports Behavioral Health Clinic to advance research in the field. We've done a number of studies on psychological readiness, a lot of studies on mental and emotional effects of ACL reconstruction surgery. I'm really interested in the athletic identity piece, and so we're working on that. There's a lot going on, and it's very exciting, and I think a lot of our colleagues really enjoy answering important questions, whether that's through research publications or getting the word out. The reason that research is really valuable is because it allows us not only to answer questions about good patient care, but it brings to light that this is an important issue, right? And we should really be latching on to this from a community, from a national standpoint, from an insurance standpoint. And so doing the work to show that this is important, I think is really valuable.
We've had this just increasing awareness of the impact and the importance of supporting mental health, and it's the same for athletes, and maybe even more critical given all of the pressures and demands that young athletes are dealing with. I mean, your concept of sports identity continues to resonate in my head because your athlete and your family doesn't have to be at the top of their game to have a really important sports identity that we need to help support.
Yes, and encourage.
Yeah, I love that. So before we wrap up, I love to ask if there is anything that we haven't talked about that you want to make sure our audience knows today.
I think we've touched on it, but probably the most important thing is that these emotional responses to injury are normal, and it's important to sort of acknowledge that and ask about it. And we want to treat the athlete from the whole perspective.
Because it's so easy to just get wrapped up in the physical injury that you typically we're thinking, okay, we're going to treat the ankle, the knee, whatever it is, and not to forget about the whole athlete.
Right.
As we wrap up, this is my favorite part of our conversation, which is where you have an opportunity to share a recommendation, advice to parents on how to raise healthy and happy kids. So, Dr. Christino, I was wondering if you could share with us what your doctor's orders are today.
Okay. Well, I think I would do two, if you don't mind.
Yeah, please.
One order would maybe be to the young athlete, okay, giving a prescription for permission to have the feelings that you're having and not be afraid of them and not think there's something wrong with you. This is a totally normal experience, and it's important to let people know what you're feeling so that they can help you.
That's really, really good advice.
And then for the parents, probably in the same line. It's important for them to realize that there's probably more going on than just the physical. To really normalize that for the kid can be really helpful. And just being there in whatever way you can be there for your athlete will be really helpful and make a big difference in their recovery.
Valuable advice. Well, thank you so much, Dr. Christino, for being here today. I've learned a lot, and I know with all the athletes out there, they're learning a lot too.
Well, thank you so much for having me.
Thank you for joining us for today's episode of Boston Children's Answers Parentcast. As always, thank you to our guest parent, Liam, and our guest expert, Dr. Christino. If you'd like more information on sports injuries and how they can affect kids, please check our website at bostonchildrens.org. Until next time, take care and be well.